So,
And
the store, the gift store.
9 o'clock, so we'll get started. We'll go through the agenda. First order of the agenda is, I'll start with saying this is an open session. This meeting and all the meetings of this team are open to the public. Proper notice has been posted and given to the media in accordance with Wisconsin statutes so that the citizenry may be aware of the time, place, and agenda of this meeting. And I will move to call to order an open meeting statement, which we just did. And then we'll do a roll call. I'll start. Judd Mold, Waupaca County Health Officer.
Haley Prosa, Waupaca County DHHS.
Ellen Stork, Waupaca Schools.
Candy Martin, New London Schools.
Erin Marsh, New London Schools.
Detective Captain Julie Kababin with the Sheriff's Office.
Thank you, Adrian, Medical Assembly.
Sarah Rowan, Nursing Supervisor, York County.
Allison Freeze, Waupaca County DHHS.
Tony Isherwood, District Attorney.
Shelley Donner, Gold Cross Ambulance.
Brandon Leschke, Waupaca Police Department.
Case Sarnabar, DHS. DHHS.
Next item is to review and approve the agenda. So I'll need a motion to approve the agenda.
I'll second.
And then the next item is minutes of the previous meeting. We'll need a motion to approve the minutes from the previous meeting.
I'll second.
Thank you. And we'll move to public comment. Is there any public comment? Seeing no public comment. All right, we will move on to prevention updates. Haley, would you like to provide some prevention updates?
Sure. Share. Screen up here.
Looks like a disc jockey over there.
I know, right? This is all really new, so bear with me here. There was a couple different things that Jed and I kind of talked about sharing. So we wanted to highlight some of the really positive things that New London had shared at our last meeting. Andy and Aaron, please feel free to jump in because these are just my scribble notes that I had from last week or last meeting. They had added a counselor and a social worker to their team after some of the past events. And then they also expanded the sources of strength to the middle school. They purchased the rights to the films Angst and Like. Angst was about anxiety and removing the stigma around that. And then Like was the impact of social media on teens. They also added mental health crisis service training to their staff, and then they were doing screening of the YRBS in the fall. Did I cover it all?
All of those things have already happened except the showing of Like. We're doing that one and we didn't want to do them back to back. So we're putting some time between Angst and Like. So
Awesome.
What is the cost of buying those?
I am not sure because I didn't pay the bill personally on that. I'd have to ask the high school principal, but it was something affordable. So
I wondered if it would be worthwhile for like the county to purchase it to lend out to the smaller school districts if it was too much for each individual
it's
district.
very well received.
Great. And then the other thing that I was just going to pull up, back in July, the Children's Health Alliance and Keeping Kids Alive, they held a conference that kind of went over, just our role as a CDR team and what that means and what some of the data that we collect is being used for. I thought it was really awesome to be able to see like how the things that we discuss and the data that we collect and that we input into their system is used. So one of the ways that they're using that is the creation of these quick looks. So these are national data, so it's not just Wisconsin specific. But our data is contributing to these various different things that are being posted and helping to inform prevention measures across the nation, not just in our state and not just in our county. So I can open up one of them. Drowning, for example. So it kind of gives an overview of, the data that was collected, the demographics, where are these drownings occurring, was there supervision, and then the source of the accidental drowning, different barriers and layers of protection, and then the prevention resources that were kind of shared as a result of those drownings. So we thought that was really cool. Another way that the data is being used, I can't show you because it's not out to the public yet, but it's called Child Dash. It's a dashboard where we can actually go in and interact with the data live. Right now, it's only at the state level. So the state has data from all of the CDR teams across the state and the fetal infant mortality review teams across the state. They are looking to expand that and then make it county specific. So we would actually be able to, in a meeting like this, open up that dashboard. And if we wanted to look at drownings or opioid related deaths, we could pull that up and we could see the demographics for our county specifically. And then more details on what prevention measures we might want to implement going from there. More to come on that. It's not available, like I said, at the county level at this time, only at the state, and only our state team members at the Children's Health Alliance have access to that data at this time. Any questions about that?
Who's joining us on Zoom?
Yes. Marilyn and Karen, do you want to introduce yourselves?
Hi, I am Marilyn Noel. I'm with the Children's Health Alliance, Injury Prevention and Death Review. And I'm the person like assigned to your team. And then Karen will introduce herself, and she's my boss.
Good morning, everyone. My name is Karen Nash. I am a program leader at Children's Health Alliance. And our role really, we are contracted with the state to provide technical support to CDR teams that exist statewide. And so that is everything from helping teams to get implemented, helping you to engage members. And now, as you all know, helping folks to figure out this virtual review process and to make sure that everyone can participate and do that in a confidential manner. So thanks.
And thanks for sharing that information, Haley. I think it's, we're meeting all the time, and the whole goal is to review deaths and look for ways to prevent future deaths. And so, and we collect data on what we're talking about. And I think, we can see where some of that data goes, and having those resources available for us to review and know what it looks like, not just from Waupaca County, but in the state, in the nation, and then have some resources to look towards for prevention. I think that's really helpful. And I think we're going to use those tools that Haley shared, going forward as much as we can. So that's just another good, I think, tool and resource that we can say, hey, this is how this team is contributing to, is we're helping provide data, and that data helps us drive decisions going forward. So thanks, Haley. All right, the next item is we will need a motion to go to closed session. I'm going to read our closed session pursuant to Wisconsin statute 19.851D, considering a strategy for crime detection and prevention, Wisconsin stat 19.851F, considering medical, social, and personal histories of specific persons or preliminary consideration of the investigation of charges against specific persons, which, if discussed in person, would likely to have a substantial adverse effect upon the reputation of any person referred to in such histories or involved in such investigations. Wisconsin statute 49.9817, limiting public disclosure of child-specific information disclosed to child death review team. Wisconsin statute 146.82(2)B, restricting redisclosure of medical information contained in records obtained pursuant to law, Wisconsin statute 4878, 2A, restricting re-disclosure of information in records of Child Protective Agency, Wisconsin statute 48.396, limiting disclosure of law enforcement records of children, to wit, discussing confidential information relating to the unexpected deaths of specific children. I will ask for a roll call vote to go into closed session. So I guess if we're going to do roll call, I'll start.
Jen.
But
I can call.
oh, yes.
Haley, I, Ellen. Candy,
Yes.
Erin,
Yes.
Julie,
Yes.
Kathy,
Yes.
Sarah,
Yes.
Allison, Bonnie,
Yes.
Shelley,
Yes.
Brandon,
Yes.
Kay,
Yes.
Karen,
Yes.
Marilyn.
Yes.
Unanimous. To go to closed session, we'll close the door